Statistically, in 2020, there were nearly 20 million new cancer cases worldwide, with colorectal cancer accounting for about 1.9 million of those cases, roughly 10%. It was responsible for nearly 1 million deaths globally. Clearly, colorectal cancer is a major health concern. Colorectal cancer risk is influenced by both non-modifiable and modifiable factors. Non-modifiable factors are beyond our control. Things like age, over 50, male gender, family history, and certain medical conditions such as inflammatory bowel disease or adenomatous polyps. On the other hand, modifiable risk factors are related to lifestyle choices, diet, exercise, smoking, and alcohol consumption. This is where supplements come into play. Today, we'll focus on one particular supplement that, when consumed in its natural form from foods, may help lower the risk of colorectal cancer. However, taking large amounts of its synthetic version in supplement form has actually raised that risk. This supplement is vitamin B9, commonly known as folate or folic acid. Vitamin B9 is essential for DNA synthesis, repair, and cell division, all vital processes for maintaining healthy tissues, including the lining of the colon. Folate naturally occurs in foods like dark leafy greens, citrus fruits, beans, and whole grains. Research consistently shows that adequate intake of dietary folate is associated with a lower risk of colorectal cancer. For example, a large study involving over 70,000 participants found that for every 260 micrograms increase in dietary folate intake, about 65% of the daily recommended 400 micrograms, the risk of colorectal cancer decreased by 7%. This suggests that folate supports DNA repair mechanisms, helping to prevent mutations that could lead to cancer. However, folic acid, the synthetic form of vitamin B9, behaves differently in the body. It is commonly added to supplements and fortified foods like breakfast cereals and bread because it is more stable and easier to store than natural folate. Interestingly, folic acid supplementation appears to have a dual effect on colorectal cancer risk. Before any cancerous lesions develop, moderate folic acid intake may support normal cell function and DNA repair, potentially helping to prevent genetic mutations in cancers. But after microscopic tumors or precancerous polyps have formed, high doses of folic acid might actually feed tumor cells, causing tumor growth and progression. This paradox highlights the complexity of nutrient-cancer interactions. A large meta-analysis including data from over 50,000 individuals found no significant effect of folic acid supplements on overall cancer incidence or on cancers of specific sites such as the large intestine, prostate, lung, or breast. This suggests that folic acid supplementation neither increases nor decreases cancer risk significantly in the general population. Further research has focused on people with a history of colorectal polyps, which are precancerous growths often detected and removed during colonoscopies. In one randomized controlled trial involving 1,021 individuals with a history of colorectal polyps, but no cancer, participants were assigned to receive either 1 ml of folic acid daily or no supplementation. After follow-up colonoscopies at 3 and 6 years, folic acid supplementation did not reduce the incidence of new polyps or advanced polyps. In fact, there was a trend toward a higher incidence of polyps in those taking folic acid. The supplement also showed no benefit in subgroups such as those with low baseline folate levels or those who consumed alcohol. These findings suggest that while natural folate from a balanced diet may help protect against colorectal cancer, folic acid supplements do not offer the same protection and may even pose risks in certain high-risk groups. Therefore, it is advisable to prioritize a diet rich in a variety of vitamins and nutrients, rather than relying on individual supplements to stay healthy and prevent cancers. Supplements like folic acid should be taken only when there is a confirmed deficiency or in specific situations where their benefits are well established. For example, folic acid is crucial for women who are pregnant or planning to become pregnant because it significantly reduces the risk of neural tube defects in the developing fetus. It also helps to treat certain blood disorders, such as hemolytic anemias or thalassemia, where folate consumption by blood cells is extraordinarily high. If you want to learn more about supplements in cancer, watch our next video on supplements to avoid with prostate cancer.